Let's talk about UTIs anyway. Okay, let's talk about UTIs and what causes UTIs and how do we get these UTIs? Because ochiraba nnyo mu basajja era ochiraba nnyo mu bakazi. Yeah, kibeera kingi nnyo. What I personally know, bangi bagamba nti ogenda mu kigo ng'omukyala nosanga omuntu nga teyasiplashinze oba teyaflashinze bulungi toilet oba nga si nnyonjo asobola okufuna UTIs. That is because of the flashback of the urine.
Yeah.
She does. Ate mu basajja, how do we get UTIs?
Abasajja balina akatule kamu era nina abakyala balina akatule kamu. So one, there are those men that like touching themselves. So his fingers are dirty.
Okay.
We can introduce those.
Germs.
Yes. Two. Then also, yes, they are not sexually transmitted, but sex increases the likelihood, or the risks, or the spread of the UTIs, especially to men.
How?
Because they will access the area of the lady.
The urinary area of
so they can
the
easily
get it. Okay. That is the only way. How do they get it? Mostly.
For the men.
There are two ways.
For the women, it's usually hygiene. Still, these fingers can introduce those germs there. Once you use a bathroom or a toilet that has been used by another sick person, if the person that has used it is not sick, you're not going to get what? That UTI. Or if the person, or if the place is being cleaned all the time, you will not get it. So it is literally exposure.
Exposure to it, yeah. Okay. How could someone, I think that one. How could someone avoid getting UTIs?
Hygiene.
Maintaining hygiene. Be it a man or
woman.
But due to the fact that men get it from women,
so women mostly
also maintaining one partner.
No, just like even if you treat 1,000 times, but your hygiene is not okay, you can't get rid of those kinds of urinary tract infections. If you don't wash your neck as well, there are people by the way when they're old enough but they don't know how to wash them. So you need to wash them perfectly well. The ladies there with children, you need to teach them as early as possible how they're supposed to clean themselves and how they're supposed to clean their undergarments.
Okay, there is a question, a very big question. How long should someone put on a knicker? How long? Let's say I have a lady or a wife who has 7 or 15 panties. How long, in accordance to math, should someone be putting on those knickers?
2 to 3 months.
2 to 3 months.
Then you change all of them.
All of them?
Yes. But
okay, an ideal lady has how many pants?
As many as possible, but at least a dozen.
At least?
Yes.
A dozen, eh? Okay. That's a very big question.
So for financial,
because of financial.
Because even the types of knickers that these ladies need to put on are specific. We usually encourage use of cotton knickers.
How do we
nylon, silk.
How do we get to know that these are cotton.
Pure cotton, you can see. I don't know how to describe it, but like how you know cotton, just the cloth cotton. That's how it should be. Maybe if you had told me, I would have brought a sample of cotton, not the knicker, but yeah. So cotton knickers are really good. And maybe there are those other, okay, mixed cotton and something else, but it should be cotton. If it's a silk, there should be a cotton, the area for our V should have
The
a
cotton
cotton part. Yeah, there should be a cotton part. Then washing them, if you can't change any knickers within that stipulated time, need to at least have some jig and soak them per week. Even if it's just 5 minutes, 5 to 10 minutes. For the white knickers, use the white jig. For the colored knickers, you can use that colored jig, the blue one. And there are also some other, okay, I've spoken about jig, but there are also some other brands. Antiseptic brands. So it's not only jig, it's just that it is what we usually use, something like that. But there are also other types. As long as it's an antiseptic liquid, it's okay.
Ironing?
Yes, ironing them would also be good.
Someone has them for 5 months and ironing works for that person.
It's okay, as long as they are washing them perfectly well.
And they are ironing them well. Okay. For those ones that have many,
we still,
because we have problems with the finances, and you might find a lady. She puts on the same knickers. Okay, she has 5. For her, she knows after bathing, she washes her knicker, puts it there.
Yeah, wash it with soap and put it on when it is completely dry.
Then changing them might be a problem.
So they just have to wash them.
Well,
But I've also seen, I think it's Omo. Omo has also made those things, and Omo is like 1,000 the shops. So you use Omo.
so UTIs, it's only hygiene that can take it away.
Yes, mostly hygiene that can prevent. Now, when you have it, we need to treat you, but to maintain yourself when you are okay, without it reoccurring. These are the things that you should do. And part of hygiene, we talked about washing. Yes, come, let's treat you then.
In a treatment, could we find ourselves treating both partners?
Now, usually, what we do, we check. For example, if a lady comes in with all those signs and symptoms, we're going to talk about the signs and symptoms. Though we said with prevention, but I think it's still the same. So, if this person comes, we need to encourage her to bring her partner. We check them as well. We don't just give the medicine. No. We check the person, we check the partner, and see if they are also affected or infected, and then we can give them the appropriate medicine. Because even the causative agents are sometimes different. We have the fungal and the bacteria, right? So even the viral and that. So it's possible for you to have maybe different ones, depending. So you have to check and be sure what we are treating. So part of prevention as well, and still part of hygiene, is the way we clean ourselves. The way we wash ourselves. There's something called douching. Someone is going to have these fingers and they think just going in there and removing whatever they found is the right thing to do. We don't encourage women to douche. Because that part cleans itself perfectly on its own. That's why every lady always finds something on their knicker. Yes, because it cleans itself.
So what do you encourage as?
Just wash on top. You don't
Just
need
bathing.
to go in and yes. Just shower it. Be clean. Then if we've gone to the toilet and we've done number 2, you don't need to clean. If you like this, you don't clean from behind to front. Clean from front to behind, because the germs from behind can easily affect you this side. And for the ladies, we are blessed enough to have different holes, but those different holes have different functions, but they can also be affected in different ways.
Okay. You were saying that you would talk about the signs and symptoms.
Signs and symptoms. Are we done with prevention? There is so much that we can do with prevention still. Before we go to the signs and symptoms, you can also have your cleaning, sometimes, yes, for the ladies that have come to the hospital, they really have this recurrent infection. I've always encouraged them to have something. There are these small bottles, small spray bottles. Have a small spray bottle with it in your bag and put jig. Then when you go to a public toilet, first spray that place, and then dry it and you can use it to be safe.
What would you advise on before you leave that part of prevention? What would you advise on the vaginal washes?
Most vaginal washes are simply helping you maintain the pH in that place. So we can use them, but for quite a while, not like an everyday thing.
So it should be used.
And at least there are those that we advise to use them, and there are those that we don't. So it depends on someone's issue or signs and symptoms.
Advise that.
You can advise your colleague so that we need to come and be checked.
Okay. Then we can go maybe.
Let's see. The signs and symptoms are quite many, but we could have pain while you are urinating. We could have itching. That's severe itching. It could even not be very severe when the disease has not yet developed so much, but there's that discomfort. And then afterwards, if you are really scratching yourself, you can get that reddening or erythema or even swelling. Then vaginal discharge, that is a lot. There is the normal discharge. Like I said, every lady will find something on their nipples, but there is that abnormal discharge. And most of the times it changes color and it changes the texture. You can literally see that this is different. And sometimes it actually smells bad. So you check yourself and see how much you are producing. And then we could have lower abdominal pain.
Okay.
It also comes with UTIs. What else? And even frequent urination.
Smell?
It can also smell bad. Then also, when you pee, you feel like it's not done. Yes, you still feel the urge to urinate even after urinating. Yes, you still feel that urge. You can also have that sign and symptom. Other urinary tract infections can even become systematic, and then you get some fever, you can get vomiting. Now those are the ones, the system. We have the urethra, which comes outside. The one that comes with the hole outside is the urethra. The urethra connects to the bladder, urinary bladder. From the urinary bladder, we have ureters that go up to the kidney. So, by any chance, if these germs move from the urinary bladder and go up to the kidneys, they can also affect the kidneys. Yes. So this is the person that will come with backache. They'll come maybe with blood in their urine. If we check, they can come with protein in urine, just other things that you don't need to find in urine when the kidneys are affected and they can no longer filter water properly, we also have those diseases. So those ones can come with tea-colored, what we call tea-colored urine. The person can come with fever, vomiting, fatigue, or general body weakness. That is when it has really gone beyond. Yes. Yeah, those are some of the signs and symptoms really. Treatment depends on what we have checked and what we have found. Yes. So you can go to the hospital and they'll order maybe a complete blood count and a urinalysis. You check your urine and see. They can also order, for those that have recurrent, they can order for the culture and sensitivity of the urine. And they see what kind of organisms, the exact kind of organisms, and the medicine that can work on them.
Okay. I think that is most of the things that are basically that.
Yes, unless we've not talked about anything, I think someone will put it in the comments and you can address it.
Okay. Thank you for watching, guys, and if at all you've not yet subscribed, please consider subscribing
and tap the bell.